Today's medical-centric topic is, what is Medicare abuse? Medicare abuse occurs when healthcare providers engage in practices that result in unnecessary costs to the Medicare program. While not always intentional, these actions can harm the system, waste resources, and potentially affect patient care. Here's a closer look at Medicare abuse, how it differs from fraud, and why it matters. 1. Definition of Medicare abuse. Medicare abuse involves billing practices that improperly increase costs or payments. Unlike Medicare fraud, abuse does not necessarily involve intentional deception, but may still violate laws and regulations. 2. Examples of Medicare abuse. Unnecessary services. Ordering or performing tests or procedures that are not medically necessary. Overcharging. Billing Medicare for services at higher rates than appropriate. Improper billing. Submitting claims with incorrect codes to receive higher payments. Charging Medicare multiple times for the same service or procedure. Violation of standards. Providing care that fails to meet professionally recognized standards. 3. Difference between Medicare abuse and fraud. Intent. Abuse involves practices that may unintentionally lead to overpayment, while fraud involves deliberate deception for financial gain. Legal consequences. Both can result in penalties, but fraud often carries harsher legal consequences due to the element of intent. 4. How Medicare abuse affects patients. Increased costs. Leads to higher healthcare expenses for Medicare beneficiaries and taxpayers. Lower quality of care. Patients may receive unnecessary or substandard treatments. System strain. Drains Medicare funds, potentially limiting resources for those in need. 5. Reporting and addressing Medicare abuse. How to stop abuse. Watch for unexplained charges, unnecessary tests, or suspicious billing patterns. Reporting abuse. Contact Medicare at 1-800-MEDICARE or the Office of Inspector General (OIG) hotline. Role of the OIG. The OIG investigates and enforces penalties for Medicare abuse and fraud. 6. Preventing Medicare abuse. For providers. Follow proper billing practices and adhere to medical necessity guidelines. For patients. Review Medicare summary notices, MSNs, and ask questions about unclear charges. Education. Understanding Medicare rules and regulations helps prevent unintentional abuse. Medicare abuse undermines the integrity of the healthcare system and can have wide-reaching financial and medical consequences.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.